Pediatrics is just babysitting. Pathologists don't talk to anyone. OB-GYNs only wear pink scrubs. Psychiatry is for doctors who want to fix their own problems. You've heard some version of these, maybe you've even repeated them. The misconceptions floating around about specialties shape which rotation students pursue, which specialties they apply to, and the careers they end up in. And because nobody corrects them, they just keep spreading. Dr. Jubbal, MedSchoolInsiders.com. Let's debunk the public perception myths and give it to you straight. Let's clear up some of the misconceptions about general surgery. First, some think that general surgery is the specialty for medical students who want to be surgeons, but aren't competitive enough to match into a more desirable surgical subspecialty, like plastic surgery, neurosurgery, orthopedic surgery, and so on. The truth is that general surgery has a great deal to offer that is unique from other surgical fields, and for that reason attracts a large number of candidates. Second, the challenging lifestyle aspects are often overstated, at least for when you're a fully trained attending physician. Ultimately, your work-life balance comes down to the type of specialization within general surgery you pursue, in addition to the type of job you seek out. You have the ability to negotiate toward a true lifestyle specialty to something more stereotypically intense. And while the common stereotype suggests radiologists are shy, socially awkward, don't like talking to people, and just sit in a dark room all day, that's far from the truth. Radiologists aren't isolated and sitting by themselves in reading rooms. While not as high energy as the hospital floor or operating room, physicians regularly visit or call the reading rooms for assistance with their patients. And because radiology is a comparatively low acuity field compared to other specialties, reading rooms are often laid back and jovial in nature. But radiologists' work isn't confined to just reading rooms. While most spend their time in reading rooms, they can also perform several procedures, ranging from life-saving procedures such as embolizing or ablating cancers with radiation-infused particles, to management-defining procedures such as taking a biopsy of a mass in deep areas of the body that no scalpel can safely reach. While some think that psychiatrists go into the field because they subconsciously want to fix their own problems, or that they're highly eclectic and strange, this isn't quite true. As a psychiatrist, you'll have to be adept at relating to a wide range of individuals, and that also requires well-developed interpersonal skills. And while it has a useful handbook, psychiatry is much more than just memorizing DSM criteria and slapping on diagnoses to patients. Psychiatrists use the DSM as a guide, but they formulate patients more holistically than that. They're looking at the psychological, socioeconomic, and physiologic causes of their symptoms as well, not just the symptoms themselves. Some think that pediatrics isn't that complicated, and it's just babysitting. That's certainly not the case. And remember, kids actually have a unique physiology that requires careful attention and nuance. Acuity and sick kids are certainly a part of pediatrics, although it's fair to say on average there's a lower amount of acuity. If you think pediatrics only includes talking to children, think again. There's a heavy family relationship building component, and you'll essentially work with at least two patients, the kid and their parents. Last, some think pediatrics is a women's field, and while the majority are certainly women, it's not as skewed as some other specialties. Approximately 70% of pediatricians are female. One common misconception about oncology is that there is little to no hope for patients with advanced cancer. However, with the advent of new therapies, as well as continued research and funding going into generating new therapies, oncology is an exciting and constantly evolving field. Patients are living longer, and there are dozens of new therapies coming out every single year that provide more options to cancer patients. There are a few misconceptions we need to set straight about family medicine. First, some say that family medicine doctors don't know much and are constantly sending referrals to specialists to handle what they can't. The truth is that family medicine doctors are some of the best when it comes to handling common presenting concerns, but need to know where their capabilities are and where to draw the line in seeking help from a specialist. They are often screening and finding conditions that allow for early intervention, like being the first person to find an arrhythmia and referring that patient to a cardiologist. Additionally, family medicine doctors are the specialists of complexity, the quarterback of the patient's healthcare needs. Because they have to know a little bit about everything, they can be the best to handle complex situations where a patient is receiving multiple treatments from multiple specialists, some of which may be conflicting. In line with this, family medicine docs are often well suited at approaching each patient holistically and as an individual, instead of as the sum of individual organs or chief complaints. Last, most equate family medicine with outpatient primary care. While most family medicine doctors do practice in a clinical setting and see patients of all age ranges, there is more flexibility to the specialty, and you can narrow it down based on your particular interests, whether that's being a hospitalist, obstetrician, or something else. There's a lot of misinformation floating around about obstetrics and gynecology. Let's set the record straight. First, no, they don't all wear pink scrubs, like in Grey's Anatomy, although you're free to should you decide to become an OB-GYN. Second, many surgeons from the traditional surgical subspecialties look down on OB-GYN as not being real surgery. This comes from C-sections being less refined than other types. There's wiggle room involved in a cesarean section, and multiple steps will be done with blunt dissection, meaning with your hands, rather than a surgical dissection using scissors and pickups, which is slower and more precise. Still, this requires knowledge of the anatomic planes between the bladder and uterus and other anatomical structures to be wary of. The stakes are high too. Things often go well, but if things go sideways, you have the baby's and mom's lives in your hands. Closure is also much faster and less precise. But this view oversimplifies the complexity and intensity of the procedure, even though it may appear straightforward from the surface. ENT is an often misunderstood field. Many people don't realize that ENT is actually a surgical subspecialty and isn't just clinical in nature. And no, they're not glorified nose pickers, but rather handle everything from the simple, straightforward issues of the head and neck to complex cancer resections and reconstructions. Also, otolaryngologists do not do hearing or vestibular tests. That's done by audiologists. However, ENTs do interpret the results and prescribe treatment when necessary. Gastroenterology is a fascinating field. After I was diagnosed with inflammatory bowel disease over 10 years ago, I was actually inspired to pursue pediatric gastroenterology so that I could help children with similar digestive disease processes. I was drawn to the procedural elements and found nutrition and digestion fascinating, but I ended up pursuing plastic surgery. That's another story told on my personal channel. Many people think that because of the colonoscopies and other procedures within GI, it's a field that's hard on your nose. The truth is, it rarely smells bad because patients are generally prepped beforehand, meaning their colons are cleaned with laxatives to improve visualizing the colon walls. While GI is technically mouth to anus, you'll find in practice that it more practically begins at the upper esophageal sphincter. Above that, it's primarily ENT, also known as otolaryngology, although there is some overlap between the two. And yes, digital rectal exams are important, and if you're a medical student or resident, don't shy away from them. And for the rest of you, make sure you're comfortable with poop if you're considering GI. Not sure which specialty is right for you? Take the free quiz at specialtyquiz.com. Let's clear up some misconceptions about sleep medicine. Sleep medicine is not sleep apnea medicine, as people often think. Sleep apnea is only one aspect of sleep health. Similarly, managing diabetes is not the same as managing metabolic health, and managing AFib is not the same as managing cardiovascular health. Sleep should be thought of as a holistic discipline, a much deeper view of what our body is doing during a state of sleep. And also, continuous positive airway pressure, or a CPAP machine, is not the only treatment for sleep apnea. Often, people think sleep medicine equals sleep apnea, which equals CPAP. However, sleep medicine is more complex and involves managing many different types of therapies that are coming to market. CPAP is only one of many. Let's clear up some of the misconceptions about pathology. The first is that pathologists aren't real doctors because they don't see patients. Although it is true that most pathologists spend the majority of their time in the lab and rarely see patients directly, they are still physicians. They went to medical school, completed residency, and passed their boards just like any other physician. Another common misconception is that all pathologists are geeky and have poor communication skills. Contrary to popular belief, pathologists don't spend all day sitting alone in a room looking at slides, nor do they do everything themselves. Pathologists often manage a team of pathology assistants and techs who do much of the grossing, slide preparation, and actual running of the tests. The pathologist's primary job is to direct the team and focus on the diagnosis of disease. Pathologists also regularly regularly communicate with various physicians, surgeons, and other members of the healthcare team to ensure patients receive accurate diagnoses and treatments. It is often said that a pathologist's diagnostic skills are only as good as their ability to communicate them effectively. Let's dispel some common misconceptions about the allergy immunology specialty. Many people say AI is boring because most of the physician's time is spent in an outpatient clinic caring for runny noses all day. While this will likely take up some time, it's far from all that's involved. The reality is the immune system is active in every single area of the body. This means allergists get to collaborate with physicians in every specialty of medicine, such as internal medicine, pediatrics, gastroenterology, pathology, and oncology. Additionally, they are always on the lookout for and ready to treat allergic emergencies like anaphylaxis, especially if they are treating patients with immunotherapy, such as allergy shots and similar treatments. These complex patients also tend to be referred because no one else has been able to figure out the problem yet, which makes this type of work exciting for problem solvers, those committed to lifelong learning, and physicians who want to stay on the cutting edge of medicine. Let's clear up some of the misconceptions about endocrinology. A lot of people think that endocrinologists are only good for prescribing hormones. Not only is this a vast oversimplification of what an endocrinologist does, but it is simply incorrect. Although hormone therapy may be a part of the treatment plan, it is not indicated for every patient, nor is it the only tool in the endocrinologist's tool belt. Endocrinologists are diagnosticians who work hard to diagnose the underlying cause of endocrinopathies and help patients get to the root of the problem. As such, treatment plans often consist of lifestyle changes, surgical referrals, and medications aimed at treating the root cause of the endocrine dysfunction. Another common misconception is that endocrinology is limited only to the treatment of diabetes and obesity. Although these metabolic diseases comprise a large part of an endocrinologist's census, their actual scope is much broader. Let's clear up some of the misconceptions about rheumatology. One big misconception is that all rheumatologists do is give steroids. While they do give corticosteroids frequently, it's not the only medication they use. In the past 30 years, new biologic medications completely changed the game for both doctors and patients. This actually leads us to our next misconception, which is that rheumatology patients are always in pain and don't get better. With these biologic medications, patient outcomes are greatly improving to the point where new rheumatology trainees aren't seeing late complications of rheumatoid arthritis anymore. Diseases like RA are no longer considered a sentence of disability for patients. In addition, many people perceive rheumatologists as nerdy or slow to act. Rheumatologic diseases are often very complex, and physicians need to go through a lot of documentation and labs when working up their patients. Even in rheumatologic emergencies, it's usually not the rheumatologist that's coming in to save the day at first. The emergency itself is usually managed by another team, whether it's cardiology, critical care, or surgery, and then rheumatology will come in afterward to treat the underlying condition. Rheumatologists are often called in when no one knows what's going on, stepping into the role of the doctor's doctor. And with the constantly evolving medications, rheumatologists have to stay up to date with the latest research. Let's clear up some of the misconceptions about infectious disease. To start, many patients believe that every infectious disease needs antibiotics. This is false. There are a variety of different pathogens that can cause infection, including bacteria, viruses, fungi, and parasites. Antibiotics are only used to treat bacterial infections and are not indicated for infections caused by other types of pathogens. In addition, many patients believe that infections are only acute, and that once they are started on medications, they don't need to follow up. This is false. There are many conditions that require longer treatments, such as tuberculosis and valley fever. Additionally, there are many chronic infections, such as HIV and hepatitis C, that must be followed closely over the long term. Let's clear up some of the misconceptions about REI. To start, many people believe that fertility treatment is only available for male and female couples. This is not true. There are many single women, LGBTQ+ couples, and even the occasional single male who seek fertility treatment. REI physicians see the full spectrum of patients with regard to race, sexual orientation, and socioeconomic status. Another misconception is that REI physicians can help you get pregnant regardless of the situation. People see celebrities in their 50s getting pregnant and believe that it's possible for everyone. The reality is that REI doctors can help enhance your ability to get pregnant, but only if it's possible in the first place. Female patients who have children later in life generally either froze their eggs when they were younger or used an egg donor. If there are no eggs left in the ovaries or no sperm being created in the testicles, REI doctors can't change that. They can, however, provide provide a donor. Lastly, many people incorrectly believe that it's an easy specialty. REIs have to be incredibly detail-oriented, as seemingly small mistakes can be the difference between your patient becoming pregnant or not. In addition, miscarriages, ectopic pregnancies, and negative pregnancy tests are common occurrences, and those conversations are never easy, even for the most seasoned physicians. Let's clear up some of the misconceptions about working as a medical scientist. A common misconception is that medical research frequently leads to immediate, groundbreaking discoveries. In reality, the process is often slow and meticulous. Significant breakthroughs are relatively rare and are usually the result of many years of sustained research. The journey involves numerous incremental advancements as opposed to dramatic new findings. The career path for medical scientists isn't always straightforward and can be quite varied. Individuals in this field may find themselves transitioning between different sectors, such as academia, industry, and government roles. There isn't a one-size-fits-all career trajectory in medical science, and success often requires flexibility and the ability to adapt to changing circumstances and opportunities. Another misconception is that medical scientists exclusively work in labs. In reality, their work is multifaceted, encompassing not only laboratory research, but also data analysis, writing research papers and grant applications, and presenting findings at conferences. This variety in tasks ensures that the role is diverse and not confined to a single setting. Lastly, many people believe there are limited job opportunities for medical scientists. The field is broad, offering diverse career opportunities in academia, the biotechnology and pharmaceutical industries, government agencies, and healthcare organizations. The job opportunities are so varied because the skill set of a medical scientist and their ability to communicate with other scientific parties is valued across multiple sectors. Every specialty has more to it than the rumor mill suggests. For the full picture on any of these, the So You Want to Be playlist covers over 50 doctor career paths.